So BEC5 went through a very interesting development phase with using it on skin cancers, and actually is still being used on skin cancer. This is a cream that's over the counter.
Yeah.
In those jurisdictions where it's legal, it can be bought over the counter, and you apply the cream, and it starts killing layer by layer the cancer cells of the skin cancer. You know, skin cancer is the most common cancer. And it just eliminates the cancer.
But just the cancer?
It only targets at the beginning it's very impressive, because the characteristic with these early cancers is that the cancer cells are quite a bit more spread than what it's evident.
Okay.
So you start applying it, and suddenly redness starts spreading out, and there's a lot of reaction. There's a little bit of an open wound in the first week or two. That's a lot bigger and scary, because it's bigger than what you thought it was. And after the second, third week, then you start seeing normal skin coming in, and covering it up. And the majority of times, there's not even a scar left, because there's no destruction of the tissue structures. If the cancer did not alter the skin layers, and it was only superficial,
right,
all the cancer cells are kicked out, and the normal cells go back into place.
Wow.
So, and it really, I mean, you can react to the vehicles used in the cream, which is salicylate and urea, I believe, in the carriers for the medication. Yeah. You may be allergic to that glycoalkaloid and may have a reaction to the glycoalkaloid, but per se it has almost no toxicity. I say almost because at some point there was one clinical trial, a phase 1 clinical trial that was run on very advanced stage 3 and stage 4 cancers, renal carcinoma and another one, where intravenous BEC5 was used. And what was found out is that at high dose intravenously, it can increase the liver enzymes. So there's a suggestion that produces some kind of liver toxicity. When that happened, the drug was immediately stopped, the medication was stopped, and the liver's normalized.
The enzyme count went back to normal?
Went back to normal.
Okay.
So other than that, there's no visible, no known side effect or toxicity from this medication.
Wow.
So it's a fantastic cure for, well, the estimations 3 million Americans right now with some form of skin cancer. And this is a easy over-the-counter solution for it. They just have to apply cream for a few weeks,
right,
until all the cancer is gone. And what I've seen is it works consistently every time. Of course, you know, if you have a very advanced cancer and you have a rate, the cream is limited, so if it's growing really fast and the cream can kill so many layers, but underneath is growing a lot faster, then you may get into a negative equation there. But otherwise it works systematically every time I've seen it get in action.
Wow, that's pretty fascinating. So it's selectively toxic to just cancer cells, doesn't have any side effects, comparatively to the gold standard.
Yes.
Right?
To the standard we were discussing, yes, very minimal, nothing.
Hi, this is Ty Bollinger. Thanks for watching. If you want to know the truth about cancer, click the link in the description below to watch our award-winning docuseries, The Truth About Cancer, A Global Quest.